to Loma Linda University Medical Center. There, she was diagnosed with hypoplastic left heart syndrome. This condition is characterized by the incomplete formation or the total absence of the left side of the heart, leaving the very taxing job of delivering blood, oxygen, and nutrients to the entire body and the lungs totally on the right side. Upon her release from Barstow, Teresa goes immediately to Loma Linda, where she receives the news about her baby's condition. The staff told her there was nothing she could do and her baby would die. She had three options: remain at Loma Linda, let your child die there; return to Barstow community, let her die there; or return home and let her die there. Teresa gathered her child and she checked into a motel. There she grieved for her child and she held her because she knew her child was going to die and there was nothing she could do about it as a parent. While at the motel, she receives a call from the neonatologist who diagnosed Stephanie Faye. He told her that Dr. Leonard Bailey, a pediatric cardiothoracic surgeon, had returned early from vacation and heard about Stephanie Faye, and he knew about her condition and wanted to speak with Teresa. Teresa returns to Loma Linda with her mother and a male companion. The father was not in attendance. They had broken up prior to Stephanie being born. Dr. Bailey told Teresa that he had seen many infants die from HLHS, and he said what they needed to survive was a heart transplant. He told her about the many years of research that he had done, and he could perform this transplant. She was excited. He also told her it is not the heart of a human, but the heart of a baboon. He saw the reluctance in her face, and he told her about an alternative procedure, which had a 40% success rate. This is a procedure the doctor neither advocated for nor did he perform because he said it was a palliative procedure, meaning that it did not cure the baby, but just lessened the pain until a suitable human heart could be found. Dr. Bailey told Teresa, infant hearts are not, they are rare. They are not being donated, and your child does not have that type of time. Given those options, Teresa went with Dr. Bailey and said, go ahead and do the procedure. They removed Stephanie Faye's defective heart and replaced it with the heart of a 9-month-old female baboon named Goobers. Now, Goobers was selected because she showed the least reaction immune-wise to Stephanie Faye. And the immunologist on the case, Dr. Conarella, she said it was their hypothesis that a baby could survive with a baboon heart in combination with their underdeveloped immune system and with the aid of the anti-suppressive drug cyclosporin, that they could survive. They do the surgery, everything is going well. Stephanie Faye survives, the heart is beating on its own, she's breathing on her own. Weeks after, she's still doing good. She's cooing and she's cawing, everything a baby does, taking her formula. Then on November the 11th, she takes a turn for the worse. An immunological attack begins on her body. She developed what is called a graft versus host disease. This is when the immune cells of the donor graft does not recognize the recipient and it begins to attack it and try to kill it because it doesn't belong in that environment. Stephanie Faye went into renal failure because they had to increase the dosage of the cyclosporin. She developed antibodies to her own red blood cells, causing her blood to clot, not allowing it to flow freely throughout her body into her brand new heart. Also, it was later discovered that the recipient and the donor did not have the same blood type. That also contributed to her death. The efforts to save baby Faye, by the way, she did die on November 15, 1984, just 20 days after receiving her new heart. The efforts to save and sustain her life sparked debate around the world in medical ethics and principles. One ethical issue was the lack of informed consent given by Teresa. There was questions if she even read it or understood what she was signing. Also, was she misled to believe that Dr. Bailey would save her daughter's life? Not that it was just an experiment, but he would indeed save her. Also, did Dr. Bailey carefully and succinctly describe to Teresa the Norwood procedure, which had that 40% success rate, even if it was just a temporary procedure that would just keep her alive for a little while? Did he really explain that to her to give her an option of going with the Norwood procedure versus going with his xenotransplantation? Cardassian, any other ethical principles?
All right, another big ethical debate was for Goobers, the 9-month-old female baboon who was euthanized in order to save baby Faye's life. Animal rights activists urged the baboon, argued that the baboon couldn't be informed nor give consent to sacrifice its life for the sake of a human. Activists were outraged that baboons were being used as organ factories, according to Cronkite. Taking an innocent animal life to save an innocent human life rode a very thin line. Animal advocates saw the cross-species xenograft as inhumane to baby Faye. If Dr. Bailey explained, he puts the lives of humans over the lives of species like baboons. The euthanasia of goobers was considered an act of murder. Professional ethics was the crux of the debate. Dr. Bailey was very optimistic that with the baboon heart, baby Faye could live to adolescence without the need of further operations. Some say baby Faye was sacrificed to advance Dr. Bailey's career. Often, ambitious surgeons wish to perform new and perhaps dangerous experimental operations. Dr. Bailey tried for 10 years to secure research grants for his work in xenografts, but was unsuccessful.
3 minutes left.
His work was funded totally by himself and colleagues who supported him. The Loma Linda Institutional Review Board approved the procedure by a 97 vote, 2 days before babyface transplant. Dr. Bailey did not attempt to find a suitable human donor before proceeding with his experiment. To many, baby Faye was a brave pioneer. Others saw her as a sacrificial victim exploited for scientific progress. The perspective of baby Faye was that there was no knowing what she was thinking. So a lot of the information came from second-person narratives. Dr. Bailey's perspective was that he was not apologetic for the use of a baboon to transplant his heart into baby Faye. He justifies his position by saying that it opened up a pathway for future successful surgeries following this operation. The perspective of the parent regarding Teresa Beauclair, she wanted her daughter to live even if that meant having her to undergo an extreme surgical procedure. And from society's perspective, the media felt that they were denied information that would have allowed them to be as informed as to what was going on. Animal rights activists were outraged at the use of a baboon and its heart into a human
1
baby.
minute left.
The general public and the religious groups in the medical community were divided. Some were for and some were against.
Now, here's some of the ethical principles that we had down. We had 4. Now, for patient autonomy, we say that it's safe to say that there was no autonomy on part of baby Faye, and that since infants can't make the decisions of their treatment for themselves, I mean, every single point of consent for the surgery was made on her behalf by her mom. Now, for justice, the only one that was done in injustice was obviously the baboon, since the baboon was sacrificed for the xenograft for the procedure. And the only way that the only concerns that would be voiced for it would be from the advocates, the animal rights advocates that would kept on protesting outside Loma Linda. Now, for beneficence, now Babyface's mother, she consented to the procedure, hoping that it would improve the chances of her daughter living, and it would fix the defect in her heart. But the transplant, the transplant team, even though they knew it was a risky procedure, they still went along with it because they were sure that there was a chance of survival up to her teens. For malfeasance, that even though the procedure was in experimental stages, Dr. Bailey still went along with it. He went along with it because he really wanted to make a breakthrough in his research of xenotransplants. The decision to use the baboon's heart without hesitation was because he believed that humans came first rather than animals. But with taking all this into account, it's the result came out with the benefits. It came out with the benefits outweighing the cons.
All right, thank you.
All right.
Next group.